Okay, so today we will be discussing Angelman Syndrome by Alexis Penn and Samantha L. So first we're going to discuss the genetic factors of Angelman Syndrome. Angelman Syndrome is a very complex genetic disorder that can occur due to numerous genetic alterations. So this may include deletion or abnormal expression of the UBE3A gene, and this is located in chromosome region 15. This generally occurs randomly, and only 3 to 5% of cases are inherited. Typically, diagnosis isn't until 1 to 4 years old, and those with Angelman syndrome are expected to live a normal lifespan. And this here demonstrates the chromosomal makeup of various abnormalities of Angelman syndrome, along with the percentage that each abnormality occurs in the population compared to a normal chromosomal makeup.
So the clinical presentation of people with Angelman syndrome, symptoms vary uniquely from person to person. Some include delayed development, which tends to become noticeable by the age of 6 to 12 months. Other signs and symptoms appear in early childhood. Other presentations are severe speech impairment, ataxia, which is the inability to coordinate voluntary movements, and difficulties with movements and balance, microcephaly, hyperactivity, epilepsy, and feeding difficulties. Also, jerky movements of the arms and legs, and a distinct behavioral pattern characterized by a happy disposition and unprovoked episodes of laughter and smiling. A person with Angelman syndrome can also have difficulty sleeping and tend to require less sleep than typical.
More specifically regarding speech and language, one with Angelman syndrome can present with an absence or near absence of speech. They generally are more receptive than expressive in regards to language and tend to use AAC and gestures as form of communication. A great article we found by Stephen Calculator called AAC Considerations for Individuals with Angelman Syndrome notes best practices for utilizing AAC with this population.
So some recommendations for intervention and communication. It's important to remember there is no cure for Angelman syndrome, but individuals with Angelman syndrome can benefit from a wide range of services, including early intervention, speech therapy, physical therapy, occupational therapy, special education, anti-epileptic medication. Many individuals with Angelman syndrome have very little to no speech, so it is important to promote communication through other means so that the individual is able to communicate his and her wants and needs. And we have also listed some recommended goal targets right here.
And lastly, we're going to quickly discuss some family and caregiver education. If you go to angelman.org, they have some great resources available for therapy, home, medical, all different areas. You can also find parent support regarding genetic counseling, family therapy, respite care, and also on angelman.org you can find free communication training series for Angelman.
And these are our references. Thanks for watching.